did in order to see if someone had a torn ACL?
Typically, the most common test is called an anterior drawer, and it's basically where the clinician would pull the lower part of the leg, from below the knee, forward to see if the ACL catches or not. This is done at a couple of different degrees. If the knee is bent greater than 30 degrees, it's considered an anterior drawer. If it's 30 degrees or less, it's called a Lockman test. It's done in a pretty swift, quick manner. As if you do it slowly, the hamstring tendons will kind of tug at the back of the tibia, and it'll give you a false positive, or a false negative rather. But if you do it quick, the hamstring tendons won't grab, and you'll feel whether if it catches, it means the ACL is still intact. If it keeps going, that means that it is not intact. That's typically bad. But for further confirmation, typically you'll need an MRI.
Okay. And what would be the repair options for a person with a torn ACL?
If they're done growing, it's a surgical procedure. It's just an ACL repair, where they either take a cadaver graft or a hamstring graft, typically from the opposite side. So if you tore your left one, they would take a hamstring graft from the right. They can also do a hamstring graft from the same leg. That's becoming more common. They just go in and repair it. I can't exactly tell you how, but if you are not done growing, they do an option called a physial sparing. So at the growth plate, they actually have to go through the growth plate and attach it a different way to preserve the growth plate so that patient can then keep growing, because it would be bad if we disrupted the growing process on one leg and the other leg kept going. That's bad. So those are typically the two options.
Okay, and what would be a summarized version of how long it would take the patient to get back to the sport, like the recovery process?
So typically it's about 3 to 6 months, depending on how well they did prior to that. We typically are done with them in therapy at about the 3-month mark, and then they go into what we call functional rehabilitation. So when we're done with therapy here at PT, they can go back to, they're ready to start hopping, jumping, running, cutting, but they're just not quite 100%. And then they go into functional rehab, and if they just take off, they can be done within a month or two and then be totally back to the sport. So you're looking at 4, 5, 6 months, depending on how well it goes.
Okay, and what would the plan be to get the person back to the sport? Like, what would be some of the exercises you would have them do here?
Well, things progress fairly simply. We start very basic. So post-op, immediately post-op, they're usually, if they have surgery on a Tuesday, they're here typically once by the end of that week. And we start on very, very, very basic exercises called a quad set. We're also making sure that they have good range of motion in both knee flexion and knee extension. And then we build from that. And really the pace at which we built is dependent upon how well that patient is doing. If they understand what we're asking for them to do, if they're doing their home exercises on the outside of PT, and then we gradually build and build and build. So we go from non-weight bearing, so like stuff on the table, where you're just lifting your leg and strengthening the hip musculature that way, to what we call closed chain, which is where their feet are on the ground, like squats, or like resisted side steps, or balance. And then we go harder from there. So stability, and we make it harder, and then we take some of that stability away. Maybe we go from double leg stance to a single leg stance and have them do squats that way, which is arguably twice as hard. And then we build strength to maximum strength, and then we develop power. And the power doesn't come until like 3 months, 4 months. That's that stuff at the end. And that's more, power is kind of like your hopping, cutting, that kind of stuff, where you're developing more speed.
And how many times would they be in here for physical therapy a week?
Typically, it's a minimum of 2. Sometimes, if they really want to get them back more quickly, it could be 3. We don't typically do any more than 3, because then you have back-to-back days, which we really try and minimize. You need that day of rest in between. So it's typically 2. I'd say that 95-98% of the people that we see are twice a week.
Okay, thank you. Yeah.
All right.
That was